Hi again. This video, I want to talk about my surgery day. If you're interested in anything else and you want me to make a video about it, let me know and I'll try my best. Or if you have any questions, please feel free to ask. I'm not a doctor. I'm not a specialist. I don't know a whole lot, but I can just share from my experience. I'm just gonna adjust my camera here. There. Okay. So day of surgery. I got a call beforehand and I was told exactly what time to be there. My surgery was planned for 10 a.m., so they wanted me there 3 hours before. 5 days prior to surgery, they had me start um, taking a shower twice a day with some special soap. Can't remember what it's called. I'm pretty sure it's like antibacterial, some kind of a liquid soap they gave me. And then they had me swab my nose with, I want to say it's bacitracin, um, because they did a before. Gosh, I should make a video about that too. So before surgery, they sent me to an internal doctor, internal medicine, and that doctor pretty much like checked my heart, my lungs, did an EKG, and basically just did blood work to make sure I was okay for surgery. Basically, to just clear me for surgery, checked my A1C, all that stuff, blood pressure, and asked me questions about my medical history. And they swabbed my nose to see if I have, geez, I'm losing it. Is it staph? I don't know. It's something that a lot of people have in their nose, but they gave me medication for inside the nose. I want to say it's bacitracin to use 5 days prior to surgery. So I did all that, and then that same place that I went to that cleared me gave me a drink, preoperative drink. It's clear, it's carb loaded, and it's made by Ensure. And I was to take that the night prior, and then it was like no food after midnight. So I set an alarm literally like at 11:50, and I got up. I had my last cup of water, and then I had that drink, and oh my gosh, it's disgusting. And it also like upset my stomach. It just did not feel make me feel good. I felt nauseous with it. Um, and supposedly it's for like a better outcome with anesthesia, which I didn't have a great outcome, so I don't know if it helped or not. Maybe it did. Maybe it could have gone worse. So day of surgery, I get up. I was supposed to take one last shower with that stuff. I took a shower with that stuff. We went to the surgery. I was so nervous. I was just so scared. I just kept having second thoughts like, am I making the right decision? Is it too late to back out? And then my husband's like, well, if you back out, is it going to get any worse? Any better? I mean, he's like, it's only going to get worse from here. I'm like, yeah, arthritis does not get better. So, anyways, I shoot all that fear away and I went into the hospital. I registered. They sent me to the orthopedic unit. I had a really lovely nurse that took care of me. They placed an IV. Um, they had me wiped down with these special wipes, like a cleansing wipes, preoperative cleansing wipes. I got into a lovely hospital gown. By the way, this was at the hospital. They were doing the surgery at a hospital, which I was glad because with past surgeries, I've had to bad reactions to anesthesia, as far as like blood pressure dropping, that sort of stuff. So I just wanted to be in a hospital just in case. Um, so yeah, so they got me ready. They did the IV. They had an anesthesiology come and talk to me, and they said normally we do a spinal, um, and that's how we numb you from the waist down. We give you also a light sedative so that you're not fully awake for the surgery. And I told him like I've had cesareans before where I get a spinal and I just have my blood pressure drops with the spinal and I feel so nauseous and I'm just throwing up and I'm trying not to throw up during the procedure, but that's my experience. And I asked him for general anesthesia, and he said that's your option. He said normally that recovery can take longer to wake up from, and to just get it out of your system. But if that's what you want, that's what we'll do. So here, I was thinking, okay, this is what I want because I've had awful experiences with the spinal. Well, it kind of backfired on me because I feel like with the general anesthesia, I felt even worse than I have with the spinal. So I did do the general anesthesia. One of the benefits, I guess, for me on for doing the general anesthesia is not having like your legs feel numb for a couple hours after surgery. Um, when you wake up with the spinal, your legs can feel numb for quite a bit, a couple hours for me. But yeah, I went with general anesthesia. So he came and had me sign the consent for anesthesia, explain the risks, had me sign it, and then he left. And then my surgeon came in and asked me if I had any other questions. I can't remember if I did. I was like so nervous. I can't remember what we spoke about. But he said, "You're going to do fine because of your dysplasia. I've set aside extra time for you. He said, I do think your surgery is going to be more complicated than most just because of your deformity. But we are going to do everything we can to get you have you have the best outcome during this for the surgery." And so that was really reassuring, and he was very calming and kind of made jokes along the way. He looked at the site where he was going to do the incision, and oh, by the way, they tell you not to shave. I think I want to say like 48 hours before your surgery. But when I had my pre-op, the doctor said this was like a week before surgery. She's like, if I were you, I'd just not shave, like starting now. Um, don't shave your legs or anything. She said they've had to turn people down because they've shaved right before surgery. Um, because they want to they want to minimize any risk of infection whatsoever. Because if you get an infection and it goes to your implant, that can be super hard to treat. Look it up; it can be bad. So I didn't shave. The doctor said he was including a spa treatment and brought out his little razor and shaved. Basically, I got a bikini line incision. If you guys want to see a picture, I can show you a picture of what it looks like now. It's just like kind of a little bit below the bikini line uh, on my operated leg. And then with the Mako robotic assist, you also get like a small incision, say like 2.5 inches for me on your opposite side. So like um, between like your hip and your waist for me. I can also send a picture if you guys want to see that. But basically, the Mako robot like pins you down. There's like 2 or 3 pins I think go in there, and it's kind of like like he said, it's kind of like a GPS. It's like the guiding point. It pins you down in that area during surgery. So I do have 2 incisions. And if you're curious about the Mako, I suggest you go on YouTube and look it up and watch videos and doctors explain about it. I don't know much about it to explain. All I know is that it pinned me down, and the doctor used it to plan for the surgery and to assist him during the surgery. So the doctor came. They had me sign the consent for the procedure, and then they wheeled me to the hospital room. I mean the surgery room, and surgery rooms are always cold, so we prepare for that. So I don't even think I was there for like even more than 5 minutes before I was falling asleep. They just quickly like put the mask on me. I was falling asleep. Next thing I know, I'm waking up in the recovery room, and I feel like shit. Excuse my language. I feel like crap. I just feel awful. I feel nauseated. I feel like I just can't wake up. Like when you're in really, really deep sleep and you just can't wake up. And I felt I was cold, but they quickly warmed me up. And I just felt a little bit of pressure to just kind of wake up and get going because they wanted to discharge me that same day and they had no beds available. But I could not get myself to wake up. And when I finally the a nurse finally said, and she's like, "Honey, we need to get you out of here today. So try your best to get up and wake up because we're gonna have you start walking here soon." And here I'm thinking, okay, I can barely even open my eyes. Like I'm in no shape to walk. And oh, I was kind of frustrated. And I think that's one of the negatives of my experience at the hospital there is they were trying to get me out the door and I was not having it. So I kind of I was starting to feel really nauseous, and in past experiences, if I eat a little bit like saltine crackers, it slowly goes away. So I started with saltine crackers. I had sips of water, slowly started to wake up more. I think within like maybe like 3 hours, I was able to get up and use the bathroom and go pee. And I got up, and they had a walker for me. I used the walker. By the way, sometimes they don't care to adjust it before they give it to you. Make sure if someone's with you and you're taking your first step, you make sure the walker's like ready for your height. I'm pretty tall, so uh, the one they gave me was like really short and it was awkward, and my husband had to adjust it before I even started walking. Um, just one thing to keep in mind. So I grabbed the walker and I'm thinking, okay, like what do I do? Like I guess I never asked, like, can I put weight on it right away? Like, do I put my full weight on it? And so I called the nurse because my husband was gonna help me just get to the bathroom. And she's like, "Oh, wait, I'm supposed to help you, not him." But I told her like what am I supposed to do? Am I how do I walk? Like, do I put all my weight on my foot, on my operated leg? And she's like, "Oh yeah, you can put your weight on it." And I was expecting pain. I mean, granted, I was still under some anesthesia and pain meds, but I was expecting pain um, when putting weight on my on my hip, and I didn't have pain. Like I put all my weight on my hip, and I did not have pain. Um, and so I walked slowly. I did feel dizzy, and I didn't feel very well coordinated, but that's mostly the anesthesia. And so I went to the bathroom. Elevated toilet seats are going to be your best friend. I'll make a video later on things like that. Um, but I sat down, I peed, I went back to my room, threw up, I think. Um, and then they did this test because before you can go home, they have to make sure your blood pressure's fine. So they have you like stand up. No, they have you sit down, they take your blood pressure, they have you stand up, and then they take it while you're standing, and if it's low, they can't discharge you. So I stood up and my blood pressure just dropped, plummeted, and they're like, "We you can't go home. We're gonna have to wait until we find you a bed." And it's like, yeah, I kept telling you guys I didn't feel good. It's kind of like an "I told you so" moment. I was really. Oh, by the way, I don't know if this will happen to you, but I was really grumpy. I think I was like not yelling at people, but just short tempered. So they finally got me a room. Um, I went to my room and I just wanted to sleep. I didn't want to eat nothing. I was just like waking up, throwing up, feeling nauseous, feeling dizzy, feeling like crap, going to the bathroom when I could, eating just a tad bit. And that night was just awful. It was awful. Like Sofran wasn't cutting it. Um, just yeah, it wasn't the pain that was awful. The pain was well controlled. It was just the nausea, the dizziness, the low, and I kept having like blood pressure lows. So I'm hoping you guys have a better experience than me if you get your surgery. But that was my experience, and I want to say not until like the very next day around maybe the next day around like 1 did I feel the nausea finally subside. And and yeah, I was able to go home that day. So after the nausea got better and I was able to eat, I had physical therapy come, and they wanted to make sure I have stairs, so they wanted to make sure I could go up the stairs. So they had me try some crutches, they had me walk with a walker, and they had me try out some stairs and showed me how to come up and down and just showed me some like basic exercises, and then they said, "Okay, you're good. You can do these things. I don't think you're going to be using a walker or crutches for very long." And then they had, let's see, they had physical therapy come, and then they had occupational therapy come, and they came and showed me kind of how to put my clothes on, what kind of tools might help me, like a leg lifter might help me get my leg into bed, because I didn't feel like I didn't have strength in in my hip. That's what it was. I didn't have strength in my hip. I could put weight on it and like do small movements to go forward, but I didn't have any strength, and it was so weird because it felt like it was useless, and it was frustrating at first. But they came and showed me how to put my clothes on and things like that. And then they sent me home. Um, and the car ride was a little bumpy, but it wasn't painful. I was just happy to be home and in my own bed. So stay tuned. I'm going to make another video about my first few days, and then I'll just keep going. And fast forward to today. I'm almost 6 weeks in Sunday today. I'll be 6 weeks in 3 more days. But I'm going to take the video one step at a time and kind of show you guys my journey so that you can know what, well, not so that you can know what to expect because every journey is different. Your journey won't be like mine. You'll have your own experience, but it's always nice to hear about other people's experiences and hopefully you can know what to expect as far as like logistics, like hospital stays, kind of that sort of stuff. If I'm making any sense at this point. Um, but yeah, I was able to go home. I do suggest, excuse me. I do suggest because of you don't have a lot of because of the numbness right after surgery, and you don't have a lot of control over your hip. Um, if you're able to take a taller vehicle, so you don't have to kind of hunch down and try to fit yourself in a car. Sometimes smaller cars, um, it's harder to get in, but if you have like a bigger vehicle and more roomier, so that you have more room to get in, and if you have something like a nice cushion to sit on, and a pillow. A pillow was a lifesaver. I had a pillow between my legs on the ride home. It was an hour ride home, and the pillow kind of like, with the car, how your legs move, it kind of kept my legs in place. So that's one tip I have for you guys. Anyway, that's the end of this video. If you have any questions, please let me know and stay tuned for the next one.